NHS staff in England are to get a 3% pay rise, Sajid Javid announced last night. The Health Secretary said the increase will be backdated to April and include nurses, paramedics, consultants, dentists and salaried GPs. He said they are being recognised for their contribution during an unprecedented year. NHS staff are rightly receiving a pay rise this year despite the wider public sector pay pause, in recognition of their extraordinary efforts, he added. We asked the independent pay review bodies for their recommendations and I'm pleased to accept them in full, with a 3% pay rise for all staff in scope, from doctors and nurses to paramedics and porters. We will back the NHS as we focus our efforts on getting through this pandemic and tackling the backlog of other health problems that has built up. I will continue to do everything I can to support all those in our health service who are working so tirelessly to care for patients. Following Mr. Javid's announcement, Prime Minister Boris Johnson said, "Our NHS staff have been heroic throughout the pandemic, providing care and saving lives. To recognise the extraordinary contribution they have made, they are receiving a 3% pay rise this year." The government initially offered 1%, which was contested by medical unions and regarded as insulting by workers. But the Department for Health confirmed it has accepted the recommendations of the NHS independent pay review bodies in full. The government says that for the average nurse, this will mean an additional £1,000 a year. The extra sum will give around £540 to cleaners and porters. Health Minister Helen Whately said, "Our NHS staff have worked incredibly hard to fight the pandemic for over 18 months and I'm glad to confirm we are accepting the pay review body's recommendations in full this year. Healthcare staff have called for a real terms pay increase. And some may be disappointed that the amount falls short of the offer from the Scottish Government, with NHS workers north of the border set to receive a 4% increase backdated to December." Unison said it was pleased the government had moved from its initial offer, but added that staff deserved more. General Secretary Christina McAnair said, "The increase falls short of what NHS staff deserve after the past 16 months. It's less than the wage rise given to Scottish health colleagues and not enough to protect the NHS. Porters, cleaners, nurses, paramedics and other health workers have waited for months for what they hoped would be a fair deal. Ministers could have paid up last year if they really valued the NHS."